Happy Friday, everyone. This is Christal, and I am so excited to be bringing this conversation to Sisters with Superpowers. You guys know we have the most informative conversations, and today's conversation is going to be right online and on trend with everything that we do here at Rolling Out for Sisters with Superpowers. We're talking about health today, and my guest is Cicely Gay. She is the board chairwoman for Black Lives Matter, and we're going to talk today a little bit about reproductive health. Reproductive health is a conversation that has been on the forefront when it comes to African American women, specifically over the last 10 years, because we've been having issues that are different than our community has ever experienced before. And so, first of all, I want to welcome you to being a guest for Sisters with Superpowers.
Thank you for having me. I'm so grateful to be here.
Well, we're excited to have you. First of all, leading a nonprofit that has been so impactful, over the last few years. Also coming in and adding some assistance to that nonprofit when there was issues. But we're talking about reproductive health. And like I mentioned, this is a conversation that has really changed within the Black community over the last 10 years, specifically the last 5 years. What have you been hearing, on the ground as you're talking with women and working in this space?
Yeah. I'm a Black mama first. Mm-hmm. I am the mother of 3 Black sons, who has raised them without the benefit of a partner for the last 20 years. My youngest just went off to college a couple of years ago. And I rarely say I'm a single mom, because there's nothing singular about the community of folks who have undergirded and supported myself and my sons. But being a mom 3 times means I have 3 very distinct birth stories, right? And as I've been thinking and talking to people about reproductive health and reproductive rights, and learning and educating myself about the disparities in Black maternal health, I realized that most of us have a birth story, and not all of them are positive. I gave birth to my oldest son when I was in high school, and I remember sitting there in labor and a nurse coming in and not asking me how I was feeling, and not asking me what I needed, but asking me how many times I had been intimate before I became pregnant. Wow. And what I remember about that now was that it was about making a decision about how I should be treated. And that's what we're hearing from Black women, that medical professionals are not only miseducated about Black women's propensity to pain, to be able to accept more pain, but also they're making decisions about whether or not Black women are telling the truth about their bodies, the truth about their pain, or even how they should be treated when they are in a reproductive health stage, or even right there on the table giving birth. I recently came back from a reproductive health conference partnering with Black Lives Matter, partnering with the Fund 2 Foundation. That's Robert Smith, his foundation. And we sat down and really talked about how we can fix this. Right. I happen to be a grandmother now. Oh, wow. My oldest son and his wife are having a baby any day now. So my perspective is very different. I am not giving birth myself, but I think every day about the statistics and recognize that Black women are 3 times more likely to die during childbirth than any other race. And I think that that information has rose to prominence because it cuts across so many other areas. Right. It cuts across wealth. It cuts across education, right? We've heard celebrities like Serena Williams who have said that they have birthing stories that have been very traumatic. And she certainly has the money, right? Right. And so I think all of us are trying to figure out how we intervene, how we advocate for Black women, how we ensure that there are enough resources so that Black women get the support that they need, but most importantly, that they are heard, that they are listened to, and that they are believed throughout not only their birthing journey, but their reproductive health journey.
Wow. When you mentioned the idea that Black women experience pain differently, that is such a sore spot, right? It's a triggering thought, because we know the history of that. We know that Black women were at one point, experimented on because they did not believe that we experienced pain. Yes. So that literally just, and understanding that, but hearing that and realizing that behavior and that mental mental process is still prevalent sometimes in healthcare systems and with doctors that we don't see ourselves in, right? The great thing is that we do have, doctors and OBGYNs that are of color. More people are getting the opportunity to visit doctors that do look like them and do understand them. But what would be your advice for women that may be in a situation where they don't feel comfortable? Because, going to the doctor can be an intimidating experience, even if you're not pregnant. But when you're pregnant, it takes on an entirely different, feeling, because not only are you concerned for yourself, but you're also carrying this baby. That can be a scary time for a lot of mothers, especially young mothers or new mothers. Yeah. So what would be your advice to women to make sure that they're getting the adequate health care and adequate, advice, from the doctor? Because so often we see people go to a doctor and not get the right information and then leave, and then there's complications.
Yeah, a few things. I think leave no power on the table. So recognize as a patient, you actually do have power. Although you may not feel like it because it's an intimidating situation where you don't have all of the knowledge, you do have power. You can get up and walk out. Right. You can choose another physician oftentimes. I know sometimes we're hindered by our insurance and co-pays and premiums, and those things make things very difficult. But at the end of the day, it is a choice that you have to be able to choose your physician in many cases. Right. And in those circumstances, recognize that if something doesn't feel right, if you're not being believed, if you're not being trusted or even respected, then you have the right to leave, right? Leave no power on the table. I think when it comes to our health medically, Black people in general are oftentimes less likely to go and get something checked out because of the history of how we've been treated, because of the financial burden that also comes from that. But still, we need to go, and we should also have an advocate, right? Have a witness, have somebody with you to take notes, somebody that might remember something that you don't, somebody that can be paying attention to the way in which the doctors are communicating between themselves, the things that are unspoken. We also, as professionals, I'm leading a foundation, I have a responsibility to hold people accountable. So if I'm making funding decisions about which nonprofits or organizations or hospitals, many of which are nonprofits, are being funded, we're taking a hard look at their practices through and through. Let's look at their charting practices, right? Let's look at whether or not they're doing what they say they're going to do. Let's hold them accountable when they've had patients there who have complained, and allow people to see that and know what those complaints are, so that we can find out in a transparent way who is really serving us and focusing on our needs.
Yeah, I love that. All great action items. Number one, there's no shame in getting up and leaving.
That's right.
Because the power is within you. And then also realizing that we have more power than we think, because if we complain, if we make if we're vocal about the issues, that can trickle down and have an effect on these healthcare systems that are receiving money from nonprofit organizations.
That's
I love that. I do want to say that in addition to taking a little pivot, because we know that Black women are often choosing to have children later in life, right? I had children early, just like you did. In college, I had my daughter. But we know that a lot of women are making the decision to put their careers first. And I think that also is having a bit of a shift in the fertility rate and people being able to reproduce maybe in a different way than years ago. What would be your advice in that way? Because I love the fact that Black women are being very intentional and putting their careers first. But I also think we do have to realize that does come with the responsibility and at least education in itself.
Yeah, and risks, right?
Right.
I love the fact that Black women in particular, or femmes, or Black birthing folks are in a position to make decisions about their lives holistically. And that means choosing to start families or not when it is right for them, right? And so I think it's difficult for us to navigate through this country and this world with all kinds of stigma associated with our life and what we should be doing and what we shouldn't. But I think for us, at any age, as long as we take hold of what is right for us and recognize that we have the right to live full, comprehensive lives that are filled with love and hopefully filled with support, we can make those choices at any age. And then, a community of sisters, right, is always something that holds us through. And fortunately, there are resources online, there are groups online, there are people that we can connect to. If there are not that you cannot find, keep asking. There are some amazing nonprofit organizations that we've even funded at Black Lives Matter. We've listed all of our grantee partners on the website. So in many ways, we've said we support them, and therefore you might be able to go to them to get support, like Black Mama Mamas Matter, for instance, who can help you through your birthing journey if that's what you need.
Well, we love that. Great information through and through. At the end of this, I love the fact that Black women, you said that sisterhood. And that's really what this conversation is about. Sisters with Superpowers rolling out, coming together and supporting Black women having each other's back. I'm not my sister's keeper. I am my sister. And that's why the conversations like these are so important. Thank you so much, Cicely, for being a part of our Sisters with Superpowers 2024. We look forward to working more with you and Black Lives Matter. Before we leave, can you let people know where they can find more information about how Black Lives Matter is working in reproductive health?
Absolutely. Just head over to blacklivesmatter.com. We have a new website. We have a transparency center. We list all of our grantee partners, lots of resources. And of course, you can always follow us on social media at BLK Lives Matter. Thank you for having me.
Absolutely. Well, thank you guys for tuning in. There's more Sisters with Superpowers to come. Stay tuned.